The fight against malaria has been going on for many decades. It's common to now see nets being soaked in insecticides in many parts and commercially produced ones being widely distributed. Nonetheless, it is not enough in the poorest countries where the disease is endemic. Most of the anti-malaria products being used on the African continent are ceasing to be effective, especially insecticides. At Kenya's Medical Research Institute, Francis Kimani runs the laboratories investigating the spread of malaria. He believes the disease remains most prevalent in Africa.
These mosquitoes are able to resist this insecticide, and as such, they're able to persist in the ecosystem, and as such, they are becoming efficient in transmitting the disease. The parasites, at the same time, we have now good evidence that they are now able to resist to commonly available, cheap, safe antimalarials. That means even if we have enough medicine and we are treating our population, the parasites are able to evade all these treatment regimes that we are putting into place.
Scientists are still searching for new methods to stop mosquitoes. They are developing ways to genetically modify mosquitoes. Scientists are also trying to use odor and taste elements to fight the transmission of malaria, since mosquitoes are attracted to blood through senses in their antennae.
So we were, on the one hand, interested in understanding how this sensory system works in mosquitoes, and then through the understanding of how it works, trying to interfere with it to break this link between mosquitoes and man.
DEET is the most widely used repellent, and it has been the most effective against mosquitoes, but it can cause irritation.
DEET is known, is a well-known repellent, toluamide, but is known to have neurological effects. It does affect synapses between neurons. That's well known. So it affects some of the enzymes, for example, that are normally used to decompose some of our neurotransmitters. So our naturally occurring products do not have these characteristics.
The WHO now targets the elimination of malaria by the end of 2015 in 10 new countries, but some feel this objective is not achievable in African countries.
One of the most ultimate things that we're looking forward to that is not in place now is vaccination. If we get our patients a proper vaccine, a good vaccine, it's not there now. If we get a good vaccine that is able to protect even our young ones who are the victims, the most vulnerable, then we'll get it right.
Medicine has made some progress in combating dengue, another disease spread by the mosquito. French pharmaceutical company Sanofi Pasteur has a vaccine appropriate for dengue. The research was led by Dr. Maria Rosario Capeding of the Research Institute for Tropical Medicine in Manila.
The study showed that it reduced the severity of the disease. It doesn't progress into the dengue hemorrhagic fever that that we are afraid of, and also I think that's enough. And also it reduces the number of hospitalizations, so I think that's enough to take to the market.
In the latest study conducted in more than 10,000 children aged 2 to 14 in Indonesia, Malaysia, Thailand, the Philippines and Vietnam, the shot's efficacy improved to 56%. The vaccine isn't for use by tourists from elsewhere in the world traveling to dengue endemic countries. Mahia Mutwa, CCTV.